And this is a colleague of mine, Joe Lewis. Joe is an occupational therapist and an associate lecturer at the University of Sydney, teaching workplace rehabilitation and work health and safety. She has 18 years in this area of practice, and she is currently completing her PhD, exploring the impact that cognitive changes can have on women's work performance after breast cancer. Over to you, Jo.
Thanks, Patrick. Good evening, everyone. Thank you. Yeah, I'll be talking about cancer and the impact that cognitive changes has on work. So people with cancer have described changes in their thinking either before, during or after cancer treatment. Previously, it was thought that chemotherapy was responsible for these changes. However, research has now indicated that people have cognitive changes before any chemotherapy has actually been administered. As such, it's believed that cognitive changes are a result of inflammation caused by the cancer itself, impacting on brain function, our emotional state, medication side effects, and the neurotoxicity of cancer treatments like chemotherapy, as well as possible genetic susceptibility as well. The incidence of cognitive changes after cancer for adults is currently unknown. Now, most studies have been done in breast cancer patients. It is estimated that up to 70% of patients will experience cognitive changes at some point in time during their cancer. The changes are generally subtle or mild, but some people describe a moderate level of symptom that impact on everyday life. For some people, the cognitive issues resolve, but for others, the problems remain for months or years after treatment. The most common difficulties people report are with concentration, memory, word finding, organising information, planning where things go or learning new information, decision making and problem solving. Whilst these things may cause difficulties when performing home-based tasks, they're most often evident when we're trying to perform work tasks where the environment is fast-paced, it's complex and it's ever-changing. There's some research, I've listed the paper on the screen there, has found that oncologists might not discuss these cognitive changes with their patients, making it hard for cancer survivors to understand why they are experiencing this cognitive decline. Then that makes it even harder to go and explain it to an employer. So whilst we might be able to make a logical link between breast cancer, lymphedema difficulties, and then difficulties using the upper limb, the link between cancer and cognitive decline is much more elusive. We conducted some research with women with breast cancer reporting cognitive difficulties to determine what types of challenges they were experiencing at work. We used a cognitive assessment model called the Perceive, Recall, Plan and Perform system of task analysis. And the main difficulties were in the areas of attention, programming and continuing. I'll go on to explain those. To understand this area of cognitive strategy difficulties, we use these quotes from these participants. Attending, and it's responsible for deciding what sensory information is or is not central to task performance. So some participants recounted problems with driving tasks associated with work. In relation to other work tasks, they said, I only read half an email message and then I press reply. They found concentrating on a task is difficult. I just sit there staring, says one participant. Programming is being able to respond to a novel, new and complex situation in a logical progression without unnecessary time to think. The quote that says, you think at the time you're doing something right and then you're not, and then I can't think how to go forward because I know I've made these boo-boos. Well, this shows that people know what they need to do, but they don't have flexible thinking strategies to use if things don't go as planned or how to respond to a changing context. Continuing is the cognitive effort being produced in the face of obstacles that may arise so that performance persists to the point of task completion. Now, one participant said, it looks like you're doing fine on the outside, but the cognitive effort required to do the task in the expected time requires so much more cognitive effort than before cancer. The fatigue then seems to result in performance issues. One participant says, I cut down the number of clients, but I'm still working as hard and as long as I was before. One participant indicated that without any compensatory strategies, she would go to work, but not actually do anything. This issue of cognitive effort and cognitive fatigue continues to be an enigmatic side effect of cancer. How, or is it different to physical fatigue? I have found these slides very helpful to help explain how and why cognitive fatigue is different to physical fatigue and why it might be occurring. A study by Ferguson did functional MRIs on participants while they were performing neuropsychological tasks, and it compared identical twins performing working memory tasks. Twin A on the screen had had breast cancer, had been treated with chemotherapy and tamoxifen. Twin B, the lower picture, had not. These scans show an increased amount of brain activity as well as recruitment of different areas of the brain to perform a simple cognitive task. It is hypothesized that cancer survivors recruit additional brain regions to compensate for changes in cognitive ability, thereby increasing the cognitive load and effort to perform an everyday task. This helps us to understand and explain cognitive fatigue. In our research, participants reported cognitive changes like a hidden disability, which is experienced by them, but difficult to explain and only observable to others as slow and hesitant work performance. People who experience cognitive changes after cancer can do their work. They are just working harder to complete a task that was previously perceived as easy. No doubt, such persistent cognitive effort and load would result in cognitive fatigue and further errors in work performance. So it remains, what can be done when people are experiencing cognitive changes at work? Well, just like Robyn was saying, we need to use a strengths-based approach. We need to look at all those things that are working well for you, and that's where we need to start. We need to consider your time of work. Can we consider your hours of work? Can you start small and build them up? Can you break your days of work up? Think about when you are at your sharpest. Is it early in the morning or is it a bit later in the day once you've got started? If possible, build your work hours and your shifts around this. In regards to the work environment, try and assess it. Where does your work have to be done? Can home be an option to bring flexibility? You need to organise your workspace, declutter and organise your physical environment, bringing structure. Consider allocating specific work tasks to a specific work environment. Reduce distractions from the environment. Turn off your email and other system notifications to have dedicated time to a specific task. Put your mobile phone in your bag, put it in another room and turn it off if you can. Keep focused on the same task. Think about planning and structure. Bringing planning and structure into your normal work habit. Allocate time for planning the day and planning the week ahead. Group similar tasks together so you can develop flow and a consistent performance. Try avoid doing different tasks at once. Really try to separate them, and particularly at the start of your return to work program. Set small goals for achieving work tasks. These might be time-based. Consider what your time frame was pre-illness and make some adjustments around this to keep yourself focused. When you're doing your work tasks, think about how you might use technology and memory aids to help address memory issues. Keep a brief diary of your workday to see how you're tracking. As OTs, we always talk about the need to grade your tasks, and we would do this based on a workplace assessment. But how you do this is you need to consider introducing one task at a time where possible to grade your return to work. So if programming or sequencing is a problem, start with repetitive, predictable and structured tasks, and then build those harder tasks in later on. And finally, think about working with others. As Robyn has said, talking with your employer is so important. Use some of the fact sheets on the Cancer Council website or this presentation or some of the other resources Robyn's pointed to discuss cognitive changes after cancer with your employer. Have an accountability and support partner at work, someone that you can trust, that you can check in with about your work tasks, structure and performance. And as Catherine explained, there may be external help through allied health professionals that you can also access to support you. Finally, it's important to maintain a healthy sleep, rest and exercise routine, and Jasmine's going to talk about that later. Thank you.
Thank you very much, Jo. That was excellent. I thought the illustration, the fMRI illustration by Ferguson, showing that there is real physiological reasons for this cognitive problem was really very illustrating. So thank you for that, and thanks for a wonderful talk.